Amid the COVID-19 pandemic, especially in situations of lockdown or restricted mobility, when women may be at home with their abusers, there is anecdotal evidence that violence is increasing. Indeed, lockdown magnifies the ability of abusers to isolate their partners and to exert violence and control. The pandemic has caused an unprecedented interest in collecting data to understand its impact on gender-based violence. This, however, is not without challenges. UNFPA's Know-How Data Initiative, the World Health Organization, and UN Women partnered to develop a decision tree to help people thinking through decisions about violence against women data collection activities during the pandemic. Before we look at the decision tree, we first need to clarify the two main sources of data on violence against women. Violence against women is commonly presented using prevalence rates, which represent proportions of women who have experienced such violence. The prevalence of violence against women can only be determined through population-based surveys with a representative sample of a particular population, in this case women. It involves interviewing women to ask highly intimate and sensitive details about whether they have experienced acts that constitute violence. These survey interviews must be conducted in a private place where information disclosed by the women cannot be overheard. Otherwise, she may risk more violence, or the information she shares could not be accurate. Another important data source is administrative data, such as information from hotlines, police records, shelters, and other service providers who respond to violence against women. Administrative data only captures a small portion of the actual number of incidents of violence, generally the most severe cases. We know from surveys that most survivors do not seek help and thus are not registered. It is important to understand that administrative data cannot be used to show that prevalence has changed. Now let's look at the decision tree. While there is huge interest in measuring the impact of COVID-19 on violence against women, it is important to question first why we want to collect data and how it will be used. That takes us to a list of questions we might attempt to answer through our research. Different questions will lead to different sources of data or data collection activities. Questions that aim at measuring the impact of COVID on prevalence of violence can only be answered through population-based surveys. But given that the pandemic may cause that researchers are not able to ensure confidential and private face-to-face interviews or offer referrals to available support services, in most contexts we should not conduct household surveys to collect data on women's experience of violence. Now let's look at the bottom part of the decision tree, which addresses alternative options researchers might consider to measure the prevalence of violence against women when face-to-face surveys cannot take place. These are intended workaround solutions that are commonly proposed, especially by researchers less familiar with violence against women data collection. And they include exploring data collection on the experience of violence through rapid assessments or remote data collection methods. In view of the risks for data quality and women's safety, these options should not be considered, so don't do it. Anyway, in most crisis situations, having a new prevalence rate is probably not the most useful type of information. So let's zoom into the left-hand portion of the decision tree to see some types of data that can be safely and reliably collected and that are useful and actionable. These other data sources could answer questions in the orange box on the upper right-hand side of the screen. Questions include whether forms of violence that women are reporting to service providers have changed, or whether women are able to access services during the pandemic. In the green boxes on the left, we offer some ways to answer these questions through either analyzing existing data or interviewing service providers. These options will result in information that can directly lead to action aimed to improve gender-responsive and survivor-centered approaches. Such information truly adds value and can be used to benefit women who experience violence during the pandemic. We hope this decision tree will help individuals, organizations, and donors involved in violence against women data collection amid COVID-19 to do so in a way that adds value and, most importantly, protects the safety of women. The decision tree is currently available in 15 languages. These translations enable researchers across the world to make ethical and safe decisions on violence against women data collection while the pandemic is still ongoing. Remember, always prioritize women's safety over data collection.